Welcome to the Dentist News Network. Postmenopausal women have a new health message to hear. 2 annual dental checkups may not be enough. Older women need more, according to research findings from the Case Western Reserve University School of Dental Medicine and the Cleveland Clinic. The message comes from a comparison study of women on and off bone strengthening biphosphonate therapies for osteoporosis. My guest is Dr. Leena Palomo. She is assistant professor of periodontics, and she was part of that study. Dr. Palomo, thanks for joining us today.
Sure, thank you for having me.
You had a different goal in this study, and what you found here was sort of happenstance. Can you talk about what you were originally looking for and what happened?
What we were looking for was the effect of long-term bisphosphonate on the periodontium in postmenopausal women. Short-term studies, ours from 2005 and several others, had shown benefits to the periodontium and specifically to the bony component of the periodontium from short-term use of bisphosphonate therapy. So a result not unlike, when postmenopausal women use bisphosphonates to prevent and treat osteoporosis, they were having a similar benefit in the bony socket that holds the teeth in place. So we're looking for what happens long-term in bisphosphonate use.
And so the findings of your study was that postmenopausal women have a higher level of periodontal disease, and there's a much bigger chance of bone loss there.
I think that at this point that's not well understood, but well accepted. So we don't know the mechanism for that, but yeah, exactly.
So what then do you recommend for these women who typically, like most people, end up going to the dentist every 6 months? For some reason, after menopause, plaque buildup is much more common, and problems are more frequent.
Well, I think what we're seeing in the most recent study is that, we weren't surprised that postmenopausal women who use bisphosphonates didn't have any adverse outcomes. So we weren't surprised by that. But what was surprising was that even though both women who were using bisphosphonates and weren't using bisphosphonates, both groups had a buildup of plaque bacterial biofilm, even though they were following guidelines and ADA recommendations and insurance benefits for 2 dental visits a year. And what we found was, despite taking advantage of their insurance, which was 2 visits a year, they probably could have used 3 to 4 visits a year.
And so biphosphonate therapy has some applications with other areas that contain bone in the body, but for these women, the jawbones are particularly susceptible. And I guess we also need to make the case, too, and make people understand something that you explained is that bone disease and gum disease are 2 completely different things.
They're 2 completely different things, and just because somebody is following what they think their insurance company says, 2 visits a year to the dentist, that may not be enough.
What conclusions do you draw as to what might be the mechanism causing this?
Oh, well, the mechanism is pretty well understood. Plaque bacterial biofilm triggers a host inflammatory response that ends in the loss of the connective tissues and bone which hold the tooth in place. Now, in a susceptible host, such as what's considered, a postmenopausal woman is considered to be a at-risk or susceptible host, that process would happen more readily. Now, that buildup of plaque bacterial biofilm can be controlled with professional cleanings and with more frequent maintenance. So doing that step can lead to a preventative endpoint.
Dr. Palomo, does this study indicate to you that women maybe perhaps getting started pre-menopause would be a good idea?
Well, that's a great direction to study in the future. But what we did currently, when we were starting to find these outcomes, is we started to ask our participants, why is it that, you only go to the dentist twice a year? I kind of wish we could see you more often to get rid of this buildup. And the common answers that we got were related to their insurance benefits. So I think that the thing we want to underscore the most is that postmenopausal women should be empowered to talk to their dentist about their specific needs, whether they need to come in 3 times a year or even 4 times a year, versus what they think is the max out because of what their insurance or their provider tells them.
And it's better off with this type of preventative care, because generally if you're going to get dental insurance, it usually covers pretty well the preventative maintenance. So at least getting started early is always a good idea.
Exactly. Prevention is always better than cure.
My guest is Dr. Leena Palomo. She is Assistant Professor of Periodontics from the Dental School at the Case Western Reserve University School of Dental Medicine and the Cleveland Clinic. Dr. Palomo, it's a great pleasure. Thanks for joining us today.
Thank you very much.